everyone. I'm Laurie Seavey, Program Manager for Impact Melanoma. Today, you'll meet Katelyn Michaud, Program Manager at Maine Cancer Foundation, our partner in prevention for over 10 years. Together, we have provided educational programs and resources to workers, residents, and visitors on the importance of limiting UV exposure to reduce the risk of skin cancer. You'll also have the pleasure of meeting Petit, a student volunteer on the how and why the University of Southern Maine provides support and training to this partnership. Please comment any questions. We'll do a Q&A at the end. In 2014, the Surgeon General touted skin cancer as a major public health concern. Impact Melanoma jumped into action and answered the call by introducing our Practice Safe Skin program, providing touchless sunscreen dispensers and sun safety education nationwide. We've learned a lot over the last 7 years, and we look forward to sharing our experiences with you today. So let's get started. It's my pleasure to introduce you to Katelyn Michaud from the Maine Cancer Foundation and Petit, nursing student at the University of Southern Maine. Hi, guys.
Hello.
Sorry, Cameron.
Thank you so much for joining me today, as it's 90 degrees out here in the Northeast, and it's what a great way to kind of kick off the holiday weekend, but talking about sunscreen and sunscreen dispensers. Katelyn, tell us a little bit about yourself and the foundation and your foundation.
Yeah, absolutely. So thank you, Laurie, first of all, and to Impact Melanoma for having me and Maine Cancer Foundation here today. As Laurie said, my name is Katelyn Michaud, and I'm a program manager at Maine Cancer Foundation. A little bit about our organization. So we're a statewide organization dedicated to reducing cancer in our state. We accomplish our mission through awarding grants to organizations throughout the state, as well as bringing people together to affect change through our state's Cancer Coalition, which is housed under Maine Cancer Foundation. Over the last 5 years, we have invested $15 million into our state to reduce the burden of cancer in Maine. MCF is unique in the fact that we're a fundraising foundation. So that means that we raise funds from the community in Maine through various events, sponsorships, donations, and then we invest those dollars right back into the state for cancer fighting programming and efforts. We know, the statistics for cancer in Maine are sobering. About 9,000 Mainers will be diagnosed each year with cancer, and about 3,000 Mainers will sadly pass away from the disease. So that's, a lot to take in, and there's a lot of work to be done. So as far as MCF's work in our grant making, our focus areas are prevention, so preventing cancer before it starts, catching it early when treatment outcomes are most successful, as well as ensuring that all Mainers have access to the best cancer care, regardless of where they live or where they choose to seek treatment. As a statewide foundation, I'm sure you can already hear in the things I've said, we are all about Maine. Our investments and efforts impact individuals from all 16 counties, and we support programs from Kittery, Maine in the southern part of the state all the way to Fort Kent in the northern part of the state on the Canadian border. Where we really overlap well with Impact Melanoma, which we'll be talking a lot about today, is of course on the cancer prevention side with skin cancer prevention and sun safety. So we'll talk a little bit about that in a little bit.
Thank you, Katelyn, and thank you for all that you do. Cameron, tell us a little bit about yourself and your involvement with our program.
Yeah, so thank you, Laurie, for having me here today. So I'm an accelerated nursing student at the University of Southern Maine. And I'm here as part of my community partnership course. My class specifically focuses on cancer awareness, resources, and education, which is how I was connected with Impact Melanoma.
Great. Thank you, Cameron. And this is really the beauty of grassroots programming. We integrate and advocate as a community to bring change. And that's really where we see change, is when it's a community-wide involvement, which we're so excited over the last 7 years with what we've done and the work that we've been able to provide. Katelyn, why don't you share some of the amazing programs we've done over the last 10 years and how some of this work has been funded?
Absolutely. As I mentioned before, one of our focus areas at MCF is cancer prevention. So there's ways to prevent a cancer diagnosis. And we know, as of course, for today's discussion, there's ways to prevent skin cancer by being safe in the sun and using sun protective measures. We also know that in Maine, there's so many wonderful outdoor opportunities in all 16 counties in all seasons. So MCF really wants to support Mainers in getting outdoors safely, especially as summer approaches and the holiday weekend is upon us. So as Laurie said, we've had a really strong partnership with Impact Melanoma over the last number of years. And we, as you'll see on this map that's coming up right here, these are all the sites that we have implemented sunscreen dispensers and other sunscreen programming throughout the state. So all of those little blue dots on the map indicate a variety of different partners, whether they're parks and rec departments, summer camps, towns, municipalities, golf courses, beaches, fishing communities, and many, many more. And we're really thrilled. There's a couple specific partnerships I wanted to mention today. We're really thrilled about the partnership with Old Orchard Beach that we'll talk a little bit more about soon, that was just launched with Impact Melanoma. And then most recently, I'm really excited to announce a new partnership between Maine Cancer Foundation, Impact Melanoma, and Maine's Bureau of Parks and Lands, which of course oversees all of Maine's beautiful state parks. So through a grant from Maine Cancer Foundation, Impact Melanoma will install sunscreen dispensers at 10 Maine state parks and provide sun safety messaging and training to the park staff. So it's 10 sites total. It's a mix between, beaches along the coast and some northern smaller sites like campgrounds and lakes. So we'll be adding more dots to this map, and I'm so excited about it, especially as a frequent visitor of the parks myself. I can't wait to go and take some selfies with the dispensers this summer with my family. And so to shift a little bit just into how this work is funded, as I mentioned, that it's through grants from Maine Cancer Foundation, these projects in particular. Of course, it takes funds to run this type of programming. It's the actual equipment of the dispensers and any training materials, the sunscreen and replacement sunscreen. And in addition to those materials, it takes, people power to run the programming. So that means like Laurie's time on behalf of Impact Melanoma, as well as the time on behalf of the sites to kind of oversee the dispenser and make sure it's all working properly. So there's a lot that kind of goes into a program like this. For Maine Cancer Foundation, as I mentioned, we're a fundraising foundation. So that means that the only way we can continue to do this type of work and award this type of grants is through raising funds and through funding partnerships. So we're always open to partnering and co-funding or co-sponsoring work like this. So I'd really encourage folks to reach out if you're interested in starting a sun safety program or supporting one with Maine Cancer Foundation.
Thank you, Katelyn. I'm so excited about the Maine State Parks. Looking forward to that so much. But, you pointed out funding, and every community is really different. Funding for these programs really come from a variety of resources across the country. Last May, when we did our educational series, we spoke to a for-profit hospital on their funding for programs, and also Cancer Resource Services in Wyoming. So if you're looking to advocate for your state, it's always a possibility. There's funding out there, and Impact Melanoma can help you kind of advocate for that funding and work with you to implement and deploy your mission and sun safety in your state. So thank you. Cameron, as a nursing student, what piqued your interest in this project?
So after talking with my instructor, I voiced an interest in skin cancer and melanoma prevention, and that's how I got connected with you. As a lot of people, I've seen my family members and friends struggle with either melanoma or skin cancer diagnosis, or just going through screening, testing, biopsies to rule it out. So that's what in part piqued my interest in Impact Melanoma. I'm also here to carry out my individual implementation project, and I chose to focus on health disparities. So for those of you who don't know, a health disparity is basically just a difference in health outcomes that are related to a particular group of people. In my class, we talk a lot about health disparities in terms of race and culture and gender, sexual orientation, and socioeconomic class. So what I love most about Impact Melanoma and what I've learned through research is that you do a lot to address the health disparities that exist in Maine and nationwide in terms of melanoma and skin cancer. Just the fact that Impact Melanoma chose to work in Maine is addressing a health disparity in itself. As Katelyn talked about, Maine has a really high incidence rate, higher than the US in terms of melanoma, and it ranks 5th in the nation for new cases. So this is a really big problem in Maine. You also address health disparities in other ways. One way is through education. After doing some research, I found that only about 60% in this study of people surveyed believe that sunscreen is an effective way to prevent melanoma. So, that's not 100%. So getting people to realize that sunscreen is important in preventing melanoma, you do this through educating the public, outdoor workers, other vulnerable populations. So that is really awesome. And then, as Laurie was telling me, a few years back, a nursing student from USM partnered with Impact Melanoma, and they were instrumental in getting the word out to the fishing community, which is a very high-risk population. They work outside. So he got local dermatologists involved. They hopped on a boat, and they headed to the islands off the coast of Maine, provided skin checks, education, and this is a very high-risk population with little access to healthcare. So that's another way that you guys have addressed health disparities. And then lastly, some other research I found, and as we've talked about, showed that more than half of people say that the reason that they don't wear sunscreen is because they forget it at home. And then some other reasons are costs. I mean, sunscreen's expensive. So Impact Melanoma's drive to install sunscreen dispensers helps eliminate those barriers to sunscreen use, gets people thinking about, I forgot my sunscreen, I got to put some on. So that's a really awesome way to address health disparities and eliminate those barriers.
Yeah, you've touched on a lot of points that we've learned over the last 7 years. This is a sunscreen when we place it out in the community, is that we hope that maybe they applied when they left the house, but they need to reapply because they're outdoors enjoying outdoor space longer than they had planned on. So another thing we do hear all the time is it's just skin cancer, and skin cancer is the most common diagnosis, and it's also the most preventable. Sunscreen is a vital part in prevention. A regular daily use of an SPF 30 or higher can reduce the risk of developing squamous cell carcinoma by 40% and lowering your risk of melanoma by 50%. So prevention is key. And what we've learned over the last 7 years is education is crucial to this success. And by layering our educational programs into communities, this is really where we see change and where we see success. And I'm really excited to talk to you today about our Old Orchard Beach project. Katelyn and I, and along with one of Cameron's fellow nursing students, Rebecca, had the opportunity to deploy sunscreen dispensers a few weeks ago in Old Orchard Beach. This is a Maine beach community, and special thanks to Kimberly McLaughlin. Kimberly is a melanoma survivor herself. She is also the town clerk at Old Orchard Beach for the last 20 years, and she is passionate about sharing her personal experience with melanoma and educating her coworkers and residents so they don't fall victim to skin cancer. So we started meeting with leadership in 2019, got a little delayed due to COVID, but we met with leadership in 2019 to address our sun protective strategies as a community. And we targeted our intervention sites. And we worked with department heads from municipalities. And we identified sunscreen dispenser location sites. We chose our Safe Skin at Work for our educational platform for this program. We based this program on outdoor workers. And outdoor workers, there's really no definition of an outdoor worker, but it is really a person that works outdoors more than 3 hours per day during the work week. So our Safe Skin at Work program really weaves nicely into communities with our sunscreen dispensing project. We provide training, we provide valuable tools to educate outdoor workers. They have an increased risk of 65% of developing skin cancer due to their extended time outdoors. Our program with Old Orchard Beach really weaves in nicely. Sunscreen dispensers as a tangible piece, education to outdoor workers, and we complement that with tools that we provide with videos and training that we also include pre and post evaluation so we can report back to leadership about are we providing what we need to our workers and really give them an education as well. And we're happy to report we delivered dispensers and education to police, fire, public works, wastewater treatment, Chamber of Commerce, and Palace Playland, that during the summer months, you're sure to find thousands of families during the summer enjoying Palace Playland. So I don't know, Katelyn, it was really great to be outside for the first time meeting people since the pandemic. So I had a great time delivering these dispensers. How about you?
Oh, I did too. I know it was a balance between, is it just, I'm so excited because we're like in the community meeting with people, but really the excitement that everybody had when they saw the dispensers and heard Laurie kind of give some education around using the dispenser and thinking about where it could go. It was just really wonderful to see. And I think that commitment from the town is really, really fantastic. I think, the fact that this is a multifaceted approach, meaning, there's working with the town in particular and all the different departments. Mm-hmm. So it's helping outdoor workers as well as, helping and supporting Maine residents and visitors that are going to Palace Playland over the summer, which I'm sure a lot of people are going to be visiting Old Orchard Beach this year, especially because everybody wants to get out. So it's just a really multifaceted approach. And I think it's going to be really fantastic. I think the other awesome thing about this project is that it can be replicated. If you are watching today and there's a town, your town you think would be able to have some sort of sun safety programming, use Old Orchard Beach as an example. It doesn't have to be a beach community. It could, Impact Melanoma can tailor things to work in your community. So we'd love to hear it if you want to start a program in your town.
Great. Thank you, Katelyn. Thank you. Yeah. And, during COVID too, we realized that there really is a place for virtual learning. And we've implemented that so that we can reach more people across the country. So we're very excited. So now that you've heard a little bit about our programming, I'd briefly like to introduce you to our sunscreen dispenser. So these are our sunscreen dispensers. They come in yellow and green. They have shatterproof hard plastic. They're weatherproof. It comes with a mirror. We use an SPF 30 broad spectrum sunscreen. And we also provide a variety of advertising opportunities for a variety of different reasons, for brand recognition, for advertising in the community about your organization. And it's really a really engaging opportunity to engage in the community and advertise in a new, impactful way. So we customize these. This happens to be Sunny, and you can spot Sunny in a variety of communities across the country. So if you have any questions about the sunscreen dispenser, please make sure you get in touch with me about that. And Katelyn, I guess I would love to ask you, is there a piece of practical advice that you would give an organization at the beginning stages of considering a sun protection program for their community?
Yeah, absolutely. I think, the thought of a project like this may seem kind of overwhelming because there's just so many, we saw all those points on the map. There's so many opportunities, so many places where a sunscreen dispenser or sunscreen education could be useful. So I think where I would kind of steer people is, thinking about what are the clearest opportunities. Who's the best audience? Is there a kind of captive audience, meaning like a summer camp or a place where people just frequent? And then what partnerships do you already have? Looking for those project champions like Kim McLaughlin at Old Orchard Beach. She really was a huge driving force in getting that moving and getting buy-in among the rest of the town. So, thinking first about what are the opportunities, what's the kind of low-hanging fruit to start from, and then maybe being able to expand from there. And then, of course, reaching out to Impact Melanoma and Laurie and the team, I think is the best place to start. They're really the experts in getting this work out, on the ground and into communities. So definitely start with Impact Melanoma.
Thank you, Katelyn. We're very passionate about what we do, and we're excited to be working with you as well. I see we have some questions in the chat, so I'd like to maybe address some of them. So Matthew David said, do you work with private day camps and sleepover camps in Maine? Yes, we do. We have worked with camps. Park and Recreation is a very large client of both the Maine Cancer Foundation and Impact Melanoma. So we've worked with programs through Poland, Maine, and other camps throughout the state. So yes, we also offer great resources and camp kits and tools that we can provide for you. So my email will be given at the end, so please get in touch with me so that we can chat about that. Michelle, if I want to bring a dispenser to my local park, but I'm not sure where to start, what would your advice be? Michelle, give me a call and we'll have a conversation and kind of talk about what your location is, who owns the park, is it a municipal park, state park, and we'll navigate you through the waters to how to kind of start opening up the doors to getting the conversations going. Let's see. So how do I initiate having dispensers in my community? Do you have to have special permission for these dispensers? Great question. We've learned a lot over the last 7 years, and depending on where the sunscreen dispensers are placed, we work with town officials in looking at where these dispensers are placed. We have agreements with them about maintenance, who's going to provide maintenance, what they're going to look like. So Park and Rec is really an instrumental key to these relationships because that's usually where people gather. So give me a shout. I'd be happy to walk you through that as well. Let's see. How do you manage these dispensers, especially in places where there are 4 seasons? Great question. We call those 12-month seasons. So maintenance is a part of our program that is very kind of individual depending on the location and the project. We can hire out maintenance contracts for sunscreen dispensers to be maintained out in the community, or we work with Park and Rec staff that are on site on a daily basis to maintain them. So there's a variety of different ways to maintain them, but maintenance is definitely something that is very important because we want them to be clean. There's advertising on them. We want that to be appropriate as well. So great question. How often do you refill these dispensers, and does the grant cover a certain amount of years? Depending on the use of the sunscreen dispenser and where they are, will really depend on how quickly we go through sunscreen. So if it's a beach location and you have a bathing suit on, we may go through a bag a week. If it's a trailhead, you may go through a bag every 2 weeks. So it all depends on the location. How do we find grants to help fund this type of project? Katelyn, I don't know, is that one that you would like to kind of?
Sure. Yeah, absolutely. I would say definitely just kind of begin with some research. So depending on where you're located, what types of foundations are in your area. Certainly, cancer organizations would be, great to approach, I think, with this type of project. And then I think as much research as you can do kind of beforehand, and then making some phone calls to foundations and just reaching out. And I think that'd be my first answer. And then just thinking too, are there other organizations in your community that you maybe could partner with to then collaborate on a grant application? So I think I'd say start there.
Excellent. And my email information will be given at the end, but it's lseavey@impactmelanoma.org. And then one other question, can you give an example of how you co-brand a dispenser? Absolutely. We kind of are all-encompassed one-stop shopping. So we provide you with multiple resources, whether it be advertising here on this little 4x6 and not offering this large display. This is also a display that we offer is a smaller display. We have larger displays that go to the floor. These sunscreen dispensers, this one particularly is on a pole, but it can be adhered to a wall with a large display. So we have resources to design and to make these displays for you. So we're really happy to kind of talk to you about that and put your branding on here and your colors. So whatever you're looking for branding is certainly a possibility. I'm not sure that I see any more questions. So I guess I maybe will end here today and thank you all for joining us as we end this educational series during Melanoma Awareness Month. And remember, as we approach the summer season, as it's 90 degrees here in the Northeast, that SPF is your BFF. And if you would like to hear more on how Impact Melanoma can assist you in your community, please contact me at lseavey@impactmelanoma.org. Thank you. Thank you so much for joining me, Katelyn and Cameron.
Thanks, everybody.
All righty.